Hello guys, today we will talk about ischemic stroke. Stroke can be of two types, that is ischemic and hemorrhagic. Ischemic when the artery is blocked, and hemorrhagic it is when the artery breaks. Ischemic it reduces the blood to the brain, and hemorrhagic it creates a pool of blood. While ischemic is more common and more often, but if ischemic resolves itself within 24 hours, it is called the transient ischemic attack. To know the details about the stroke, we should have a good knowledge about the brain anatomy. Brain consists of three parts. The first one is the cerebrum. Cerebrum consists of two hemispheres, the left and the right. The right cerebrum controls the muscles on the left, and the left controls the muscles on the right. It works alternatively. Each cortex is divided into four lobes, that is the frontal, parietal, temporal and occipital. Here with the function, the frontal lobe has the function of movement, execute function. Temporal lobe has the function of hearing, smell, memory, language and facial recognition. The occipital lobe has the function of vision. Parietal lobe has the function of sensory information. Then the second part is the cerebellum. The cerebellum consists of the function of muscle coordination and balance. The third part is the brain stem, which connects the brain to the spinal cord, and the brain stem it consists of pons and medulla oblongata. It has function like heart rate control, blood pressure, gastrointestinal function, breathing and consciousness. The blood supply of the brain. The brain receives the blood from two main arteries, that is the internal carotid artery and the vertebral artery. The vertebral artery has again some sub-branches of the artery or the communicating arteries, that is the basilar artery, the posterior cerebral artery and the posterior communicating artery. And the internal carotid artery has again the branches and the communicating artery, that is the cerebral artery. That is the cerebral artery, the anterior cerebral artery and the anterior communicating artery. The main function of all these arteries is to form the circle of Willis. Circle of Willis, what is it? Offers alternative ways for blood to get around obstructions. When there is an obstruction, the circle of Willis, as it is connected to many arteries, so it offers alternative ways for the blood to move through the brain. That's why the circle of Willis is very important in the brain. The main mechanism of ischemic stroke. Ischemic stroke has two main mechanisms. The first one is the endothelial cell destruction. That is, the irritants damage the endothelium. Damage becomes site for atherosclerosis. A plaque forms, obstructs blood flow. What is a plaque? A plaque is a buildup of fats, cholesterol, proteins, calcium and immune cells, and it obstructs the blood flow. The most common site for atherosclerosis is the internal carotid artery and the middle cerebral artery. What is a stroke? Stroke is a sudden or complete blockage of an artery. The second mechanism is embolism. The blood clot breaks off from one location and gets lodged into another. This is known as embolism. The two main mechanisms were embolism and endothelial cell destruction. The next comes the lacunar stroke. It is a different special kind of stroke in which damaged brain forms cyst which looks like this, and there is hyaline atherosclerosis. What is hyaline atherosclerosis? When the blockage is by protein, the main blockage portion or the part is filled with protein, and it results from hypertension and diabetes. This causes the lacunar stroke. The symptoms of the stroke, it depends exactly on the part which is affected in the brain. Supposingly, if the anterior middle cerebral artery is affected, then the symptoms will be numbness, sudden muscle weakness. If the Broca's area is affected, then the symptom will be slurred speech. If the Wernicke's area is affected, then there will be difficulty understanding the speech. And if the post-cerebral artery is affected, then there will be difficulty in the vision. To remember the symptoms more nicely, there is an acronym, that is FAST. F stands for facial drooping will be there, A for arm weakness, and S for speech difficulties. T for time, of course, time is not a symptom, but time is here to let us and keep this in mind to get the symptoms recovered as soon as possible. That's why T for time is given. Diagnosis of the ischemic stroke. Diagnosis can be done by CT scan or MRI, and we can also use angiography. Angiography can show us the exact location of the stroke. The treatment, of course, when there is a stroke, there is a blockage, then the treatment is to re-establish the blood flow. How can we do this? We can do this by thrombolytic enzymes, by giving thrombolytic enzymes that activates the body's clot bursting mechanism, or by tissue plasminogen activator, that is the TPA. Next is the aspirin. It prevents more clots. Surgery. Surgery can be done by physically removing of the clot or mechanical embolus removal in the cerebral ischemia. This is called the MRCI. So this was the treatment, diagnostic mechanism of the causes of the ischemic stroke, the blood supply, the anatomy of the brain, and I hope it helped you to understand ischemic stroke completely. Thank you.